Good afternoon, ladies and gentlemen. We are Hepatosense, and our goal is to detect liver cancer earlier. Next slide. So liver cancer has a high mortality rate in the United States, and compliance with liver cancer screening is extremely low. But how can we quantify the clinical impact of the mortality on the population? So if we look at the late-stage survival rates, they're only at 3% when we diagnose them at a late stage. But now, if we compare it to an early stage diagnosis, we could change this number to 30%. So here at Hepatosense, what we have done is that we've designed a method to address the patient compliance and thus facilitate early detection with an at-home screening test.
So our test utilizes a rapid flow technology. So think of something similar to how a pregnancy test would work. So the patient would put the saliva on the sponge, and then the sponge would wick up to the indicator strip that by capillary action, where we have our different biomarkers for early detection printed on those indicator strips. There's a proof of concept for this type of test out there. So there's a similar type of test that's available for HIV. And so how this would be prescribed would be the doctor would prescribe the test to be done at home along with an app. So the results, once they do the test, they would take a picture of the strip results, and then that would be uploaded into the doctor interface.
So our kit comes with a simple 4-step procedure. So the patient is going to rinse out their mouth and then collect the saliva sample on the sponge and wait about a minute or so and take a picture of the test strip that we have inside our device and upload that onto our platform. And on the other side, the doctor is going to be able to log into our platform and take a look at the patient's test results over the period of time. So if the levels of the biomarkers are elevated, the patient is red flagged by the portal, and the doctor can reach out to the patient about a follow-up visit. And what we've also done is that we've embedded tools into our app to help the patients become more compliant with their appointments. So now if we take a look at the further clinical impact that this could have even on the industry as well is targeted therapy costs are up to $150,000 a year per patient. If they're diagnosed at a late stage. And now, going further, if they aren't diagnosed at a later time, then they're going to require a transplant, and that's going to end up costing about $500,000 or so. So in short, ladies and gentlemen, with your help, we intend to have a significant clinical impact and save thousands of lives and save thousands of dollars while doing so. Thank you.
Does a false negative rate put you at legal jeopardy?
So these biomarkers are FDA approved for this indication. The reason that they're not implemented very much is because they are done in the clinic. So when they come in, the screening is usually good enough. The problem is that only 2% of patients comply with the biannual screening. So we're thinking if they could use these markers that we know are sensitive at home, then maybe when we pick that up, we could like really target these patients to get them back in for the other screening, imaging.
In the clinic, are they also done with a saliva test?
No, so that would be unique. They're usually done from a blood test.
So are we sure that the saliva test will be as accurate?
Well, essentially, like what we're trying to do is, like in terms of accuracy. Well, I guess in terms of accuracy, the saliva test is essentially just a preliminary screening. So what we're trying to really do is we're addressing the patient compliance issue because since, as Mandy mentioned, only 2% of patients actually come in for their biannual screening. So if we could address the 98% of the other population, which is still high risk, that aren't coming in for the biannual screening, if a certain percentage could still even come in, then we'll be able to do further screening and testing as well.
Yeah, and for AFP, there is a correlation between the serum levels that they find and the amount they find in the saliva. So there's evidence to back the science.
If your target population are those that won't come in for a biannual checkup, what's the likelihood of them using a kit at home?
Yeah, so we're trying to think how a way to incentivize patients to use this at home. So, well, one, we think that that's already an increase in incentive that they don't have to actually come in for an appointment. So I think that just the ease of use is going to be nice. We tried to put in some different tools into the app that could make it try and get them more invested in their own health. So I think that when they have these tools and they see that the doctors are more interacting with them a little bit more, we can get them to be a bit more involved in their care.
And in addition to that, we're also planning on implementing another feature into our platform, which is basically also trying to bridge the gap between the communication between the patient and the doctor as well. So, and how are we going to do that? Right now we're still in the preliminary phases of that, but so say for example the patient is at home and like you said, like the population that we're trying to address here, it's a little difficult for them to come into the clinic. So we're going to try to design it in a way that with the click of a button, they could be mailed a kit, at home. So they don't really actually have to come in to pick up the kit either. Thank you.